This is the exercise ball bounce. This subtle movement can help your baby settle into your pelvis and also aids in softening the cervix, which is helpful as you progress into labour. If you're at risk of preterm labour or you've been diagnosed with placenta previa, preeclampsia or low amniotic fluid, please consult your healthcare practitioner prior to commencing any exercises. Sit on your exercise ball with your feet flat on the floor. Keep your legs spread comfortably wide for balance. Start gently bouncing up and down, keeping the motion light and rhythmic. The gentle rocking motion can help relieve pressure on your lower back and support your pelvic floor. Try bouncing for a few minutes at a time. You can also do circular motions, and you can return to this throughout the day whenever you feel tension or restlessness. Many expectant parents find this soothing as they approach labour. If you do commence these exercises and you notice anything unusual about your body or anything listed in the description below, please contact your doctor immediately.